Welcome to the Digital Health Pulse. I'm Trevor Yasinow. Let's jump into today's conversation. Hi, everyone. Welcome to another episode of the Digital Health Pulse video series with myself, Trevor Yasinow. I am joined today by Z Goldstein, co-founder and CEO for Mellie. Welcome, Z. Honored to have you on.
Thank you for having me. Excited to be here.
Of course. So, Z, my first question for you is, can you tell me more about Mellie?
I can tell you a lot about Mellie. We are a new player in the family caregiving space. We're coming to solve a very big problem of many people in need. There are around 53 million family caregivers in North America alone. They deal with a lot, and it's a very big pain for many families. And we see it as our mission to bring our expertise in building tech. We have a very extensive experience in building tech for many years in a very different space and helping with technology and people to really address the pain point of caregiving. And we're solving really three main problems. The first one is really around knowledge and access to knowledge. Many caregivers don't have access to knowledge and they really trying to figure out a lot of things themselves. We give them access to resources. So the second problem you see in many cases is people don't know really how to execute care and they're trying to figure out things themselves and find out resources. The distance problem, which is very common, is also creating additional burden. And the third thing is really the operation. The day-to-day operation of caregiving is pretty overwhelming, and there's nothing really that gives them like the end-to-end, operation system that gives them a way to navigate and do all the things that they need. And this is where we saw an opportunity as entrepreneurs and people coming with heavy tech background to build something robust, scalable, that is designed for the modern world, and really at the same time give them access to experts behind it that can really help them to navigate. So in a nutshell, we're solving a very big problem, bringing tech to the front and really try to help many family caregivers to deal with a little bit less stress and reduce their pain as much as we can.
Incredible. So, what makes your company unique compared to others in the industry?
Yeah, I think that the first thing that we see is that the approach we've taken allows us to be a little bit more, I guess, accessible. One of the things that we saw is that a lot of the companies that build great companies, by the way, but they built businesses really, the foundation was much more on the services side, building a very large care management team. And it made a lot of sense. I think it's a good way to approach it, but it hits a cap of scale at some point because people need someone next to them or something next to them that will not be just a person. And they need something that will be available sometimes in a situation where they can't just get on a call with the person and ask them questions. They need some guidance that will be a little bit more less dependent on, the time of the day where someone is available for them. And they also need something that will be a little bit more connected to the use cases they deal with day to day, tools that will help them with reminders and things like that, and so on. So what we saw as an opportunity to build a software first solution that will be backed by experts that can actually help you with the navigation and some of the challenges you have as a caregiver, versus to build an army of care coordinators that will give you advice and guide you, and a technology that will help you to kind of manage the care coordination side. For us, the platform is family caregivers facing, it's consumer facing. It's designed for the family caregivers with a very deep understanding of their pain. And then everything else is more like the back office, and the things that we're doing is really like the operational of how we manage them in a scalable way. That change in the approach is what allows us to be way more affordable, accessible, scalable, and it comes in many shapes and forms. And employers and other go-to-markets we're approaching are seeing it. We're getting the feedback. Okay, that's a different. We haven't seen anything like that.
That's super helpful. Yeah, that leads into my next question because I want to understand with Mellie, who are your primary customers and how do they benefit from the solution?
So the first one I would say is we started with employers, and this is where we saw a great opportunity to assist many companies that have seen the pain but weren't able really to bring something together to the table. And we're not the first one doing it, but I think we're the first one coming with a solution that is a bit more tech first and is also allowing any employer to get access to a caregiving benefit like ours. And I'm saying it because we're the most flexible platform in terms of the business options or the business model that we offer those employers. A lot of the employers today are not looking to pay expensive premiums on benefits. They're looking to actually save on cost of benefit, and they're trying to and looking for flexibility on the benefit. They're bombarded with a lot of point solutions, and they're trying to bring as much as they can for their employees. But it's very hard when everybody's trying to charge a few more dollars on a point solution. And we're aware of that. And we came to the table prepared for that. And we're coming with a lot of flexibility on our business approach and business model that we offer that give them more options to choose and how they want to bring these solutions to the table. So that's something that we started with. So that's the employer. We're starting to work with carriers where they see that there's they're basically seeing the importance of this and something that is coming and becoming, I would say, a priority because just the reality of caregiving is hitting us from many fronts, and I think they're seeing that their market is going there as well. Um, we are also working with some providers. There was a big government program that CMS announced 2 years ago called Guide, and that triggered, I would say, one of the first programs where CMS, sorry, took the family caregiving problem and put it like in its own slot and really talked about the importance of solving it. Finally, someone is saying, "Pay you, Mr. Provider, to support family caregivers because they understood that dementia and Alzheimer patients are not going to be just fine at home without giving family caregivers the right resources, knowledge, and access that they need in order to support their loved ones." So these are the main things that we started doing, and this is where we find success. There are a few more, but this is kind of where the company is focusing. As a startup, you have to focus on a few things that you can be very good at and then expand. But we see a lot of great opportunities to expand down the road.
That's incredible. Yeah, I think tackling the employer, tackling the payer, and also even going after the providers, that's so important for a multifaceted solution. Sometimes companies just stay in one lane, but if they're not able to really attack the majority of these employer populations or majority of just any population, they're missing a big mark, I would say. So completely get it.
When we started, we saw that when you look on the market, you see that there's many of our competitors have looked in the market and said, okay, let's go after those that really can afford a care navigator or care coordinator, care manager that will be available for the employees. And the price point they put together was a bit more challenging for some of the players to come in. When we started, we actually researched the entire US market. We looked how many employers are above 2,000 employees, above 5,000 employees. And then we started looking how many of them are offering caregiving solutions today. And we saw that most of them, I would say 95% of them, are not offering any of those solutions. And the main reason why not is because it wasn't really affordable. They couldn't really pay the premiums that were asked. And that's where we saw the opportunity. Because if you look on big America, if you look where the problem is and where those organizations actually need the help, they will never be able to afford some of the other options. When you build a software first solution, this is where there's an opportunity to actually give them something that can actually address their employees' needs. And that's where we saw, okay, there's this blue ocean there that is not being tapped. We have to do something there.
Absolutely. And everyone cares about cost savings. That is, the immediate reaction. How can we get an ROI? So it's amazing to see that that's at the forefront of what you're thinking about for this solution. So incredible. What is one exciting trend that you're seeing in the digital health space right now?
Exciting trend in digital health. Well, I think that there's growing awareness for, again, talking about where I'm coming from. I think if we started in our space 10 years ago, we were probably going like an uphill battle. I mean, trying to explain and educate employers of why they need to start thinking about family as a priority, understanding the halo effect that they provide to their brand as a company when they provide, becoming like a caring company, like someone that is actually putting the family on the front line. I think that the trend in digital health is that I see more companies coming in with solutions like Mellie and trying to really put in the front line the employer and like they make them responsible and accountable for the importance of the entire family. And it's not only family caregiving; it's also on the mental health side, and it's also on on the children's side and parents and other challenging other challenging moments in family evolution, even fertility, as far as I see it, and menopause. I mean, these are things that families are dealing with, and I think that the evolution that we're seeing, the type of benefit that's coming, and the wonderful companies that are being built around it are creating an opportunity for employers to become a much more important player in any family, and how you think about my next job. Like, is this going to help me to build my family, or is just going to be paid, someone that pays me my salary? And the fact that we see this evolution, to me, it's exciting. I mean, I've been in multiple conferences this year. I see that these companies and vendors coming in. I think this is a very exciting trend that is continuously kind of evolving.
It's amazing. So what does the next year look like for Mellie? Any big goals or milestones on the horizon? I'd love to know.
Well, as a startup, you need the growth and you need to continue like delivering, of course. So we have a lot of goals, of course. Um, we're seeing great momentum right now with employers, and we're going to continue investing there. We have some amazing case studies. We're seeing some great numbers on utilization that I don't think we were expecting to see, honestly. I mean, we knew that tech first will create a different type of dynamic, and it's one of our differentiators. I should have mentioned it earlier, but when we go into an employer, a year ago, I couldn't say it because we just started working with some of our employers, but now we see the actual utilization. Within 30 days, we see like 20% utilization, which is unheard of. I think that the next year is going to be very exciting. I think we'll see more, um, definitely more employers that are interested in what we're doing and want to bring the right solution to their employees. And I think that I always think about employers as they have that responsibility and the overarching kind of they look on the entire employee base and they think, okay, what are we doing next to really support them and give them something meaningful? We're getting very good at understanding which employers have the right interest to step in and provide a solution like caregiving. If it's the right age of the employees, if it's the right population, if it's the type of work that they do. And when we understand that and we become better in how we approach them and we talk with them and we listen to their needs and how the pain of their employees and how they go to work every day and what the things they go through, I think we're becoming better also in how we offer Mellie and how we position ourselves. And I think that's something that I see a great opportunity for us to grow with.
Well, Z, it was great to learn more about what Mellie is doing in the digital health space today. I'm looking forward to seeing all the exciting things, all the exciting news, and I can't wait to see where you guys will go. So thank you so much for joining me today.
Absolutely. Thank you for having me. I really enjoyed talking.
That's a wrap for this episode of the Digital Health Pulse. A huge thank you to my guest today. If you enjoyed this conversation, be sure to like, repost, share, and follow for more chats with the top innovators and leaders in digital health. Have a company you'd love to see featured? Drop a comment or reach out. Thanks for watching, and I'll see you in the next episode.